Hello, I am I am Shana-Lee Scott from Breathe and Exhale. I am the CEO and founder. And OMG. Hi. Still getting used to this whole live thing. But hello. As I was saying, I am Shana-Lee Scott. I am the Breathe and Exhale CEO and founder. And I am actually starting in July, Tuesday tip, where I am coming on here, not for a long video or anything like that, but sharing a tip, giving you some type of information that hopefully you can walk away saying, I didn't know about it, or let me go and research that some more. Either way, it's a win, right? So today for our first Tuesday tip, I am talking about for the month of July, it is National Minority Mental Health Awareness Month. And I am speaking on it because one, not many people know. We know that May is for Mental Health Awareness Month, but July is actually for National Minorities Mental Health Awareness Month. And the reason for this, it actually all started with BB Campbell and she was on a mission to bring more awareness to the minority community about mental health, helping to combat the stigma surrounding mental health, combating the stigma, as well as providing resources for the minority community. And she actually partnered with her friend Linda Boyd, and they worked together. They started in their community. They were like, listen, we need to dedicate a whole month to helping the community to learn more about mental health, combating the stigma, and getting the resources. And oftentimes that what happens is that there is a disparity between minorities receiving the help that they truly need for mental health. So they took on that mission and they started doing mental health checkups. They realized what was the importance of it, and they started right there in their community and making that difference. They actually got other minority mental health facilities involved, helping them with their cause, and they started rallying the facilities and helping individuals. Then what they end up doing, they actually went to and got the representative Albert Wynn as well as Diane Watson to actually sign into legislation making July the official month for National Minorities Mental Health Awareness Month in 2006. That was just in 2006 that they did this. So I wanted to share, the journey of those two ladies, making that step forward into seeing a problem and solving for it. They didn't wait for anyone. They didn't say that, oh, I couldn't do it because they were too busy, or they made all the different excuses. Or what happens is that we tend to overthink and then we don't do anything, right? Or we allow fear. What would people think about us? What would people, should I be doing this? They didn't care. They were trailblazers and they went after it and they went to do it. So with that, I want to encourage you. To, if you see a problem and you have an idea of how to solve it, start focusing on how to solve it, and just going for it. It's okay. And start trying to solve the problem that you identify and work on it. But with that, I wanted to just jump back to bringing the awareness of National Minorities Mental Health Awareness Month. And I wanted to just inform you of some ways that you can help, right? If you see someone or someone that is in need for their mental health, encourage them to go and seek out a professional, to seek out a therapist. help someone in need. You can also donate to various nonprofit organizations that are centered around mental health as well as minority mental health awareness. It's also, you can volunteer. They are in need of volunteers. You can seek out volunteership. And something that is so simple but can be so overlooked is simply be kind to people. Right now, everyone is going through a lot, or they're dealing with something, and they may not physically tell you, or they may not verbally tell you, or they may not, tell you everything that's going on in them. It's kind of like, when you walk past somebody, it's like, how you doing? And you still walking before you actually stand there and hear what the person says. So they're like, I'm good. The person can actually say, no, I'm falling apart. And you just wouldn't know because we're so in a rush to the next thing. And I want to just tell you that maybe for this month to slow down a little bit. Slow down and ask people truly how they're doing. For that friend that you haven't talked to in a while, and I'm guilty of it, that you may be busy or you look at the time like, oh my gosh, it's late, that you reach out to that friend and you ask them, how are they doing? How are they truly doing? And because I have to do better at that. So let's make that a goal for the month of July, to kind of just slow down and really start checking in with people and asking people, how are they doing? The other thing I want to make us aware of with National Minorities Mental Health Awareness, I want you to really think about, or not necessarily think about, but I wanted to provide you with free services. Oftentimes when it comes to the minority community, it's a disparity between being able to receive resources, to get help for their mental illness. And I wanted to share with you just a few tips on how to go about receiving free services. And one of the ways, there are nonprofit organizations that are locally that you can Google, or if you cannot Google, you can go to the library, and they have computers access for you, and find out the local nonprofit organizations that provide free services. The other way that I didn't know, that as I was researching this for you, and I was like, oh wow, I never knew that. There are local universities. If you go to your local university and they have a psychology department, then you can actually go and you can actually go to their psychology department, and oftentimes they will have graduate students there that are providing free services, they provide free services, or it's too little to no cost. So check out your local university to seek out help. And then the third tip I want to give you is, majority of employers have this service called EAP, which is the Employee Assistance Program. And it's actually free services. You can get services for therapy, and all you have to do is just give them a phone call. They will help you find a therapist, and and then you can go, and depending on your employer, it depends on how many free visits you can get. You got to get 3, or you can get 5, and things like that. So you can do that. And I will tell you, because oftentimes what happens, many people always think they cannot, they don't want their employer in their business, right? Well, I wanted to share this just because in my other profession, I am in human resources. And before I was in the specialty that I'm in, I was in benefits. And I have been in meetings with executives, as well as I have received all the different invoices and different paperwork for benefits. And we do not know. A lot of times people don't want to go through their EAP services because they think their employer will know, and their employer won't know. We don't know. It's straight up confidential. It is confidential. I promise you it's confidential. So if you are in need of services and you have and if you are employed, please go and see about, just getting the phone number. All you need to do is just email your benefits or your HR department. And a lot of times it's actually in your benefits booklet. So remember that booklet they give you, it may be digital or they mail it to you and it's a booklet that, talk to you about your benefits. It's in there. So you don't even have to contact anybody in your benefits department. It is in there and you can find out the phone number to call, and those individuals will help you, walk you through. You can also reach out to different crisis lines that's available and get their phone number and reach out to them. So those are some services that are free. That are free to you. So again, I wanted to come out here for your Tuesday tip to share with you, to bring you aware of the National Minorities Mental Health Awareness Month. And I will be coming on here every Tuesday. Today was a little hectic, but I am hoping to come on here earlier and have just a Tuesday tip to share with you. And today I wanted to bring awareness to the month of July being the National Minorities Mental Health Awareness Month, and tell you about B.B. Campbell and Linda Boyd and how they saw a problem and they decided to go and actually combat that and get the answer and help solve the problem that they saw. And with combating the stigma, providing the resources, and they started in their community. Encouraging people to go and get mental health checkups. Then they started rallying mental health facilities, getting them involved, and then made their ways to Congress to get it signed into and be nationally recognized as July as the National Minorities Mental Health Awareness Month. And this and the reasons for this is oftentimes minorities is a stigma associated to mental health that we need to work on combating, as well as providing the resources that they would need to get assistance with their mental health. And again, also wanted to provide you with free ways that you can get free assistance if you know someone that is in need of mental health. You can go visit one of the local nonprofit organizations that specializes in mental health. You can call any of the crisis hotline. You can also visit your local university in the psychology department. And then if you are employed and your employer has an EAP system, which majority, I think it's actually a requirement to have an EAP system. If you work for a company more than 25, but to have the EAP, and it's free services there. You can also wanted to share with you that ways that you can help out for this month is, one, you can donate. You can also volunteer at one of the facilities. Also, you can just be kind to someone. Let's slow down. Let's start asking each other and checking in with each other. How are you doing? And how are you really doing? How are you really doing? Not this on the surface. How are you really doing? And having those conversations with individuals. And then also just remembering what BB and what Linda did. They started something. They may have had fear. They maybe overthought it. They maybe were like, what are people may think? But that didn't stop them. That didn't stop them from seeing that problem and being determined to solve for that problem. So I want to encourage you, if you see a problem, or if you know, or it's an idea that you have that you're not sure, like, should I do this? Should I not? And the fear is getting to you. I want to encourage you to do it even even when you're fearful. Do it even when you're fearful, or do it when you don't have all the answers. Just simply do it. Just do it. If something is in you telling you to do it, and I want to encourage you to do it. I want to encourage you to do it because trust me, I am on that journey myself to just do it. So wanted to share that with you. That is the Tuesday tip. And I hope you had a great day. And if you haven't joined our mailing list, join our mailing list because I am, I'm excited about what is to come for year 2. And we are going to be providing more content. And one of the contents that I am going to be providing is coming on here on Tuesdays, giving you that Tuesday tip. Also, we have some blogs on the website, so check us out. Okay. Well, thank you again. Thank you for joining me for Tuesday Tip. Bye.